Hi, this is Dr. Kerry Gelb, host of the film and documentary Open Your Eyes. Today I have a special guest, Dr. Jim Stringham. Jim is a PhD. He's a neuro vision scientist. He has been at Harvard. He has done research for the Air Force, and he's currently at the Duke Eye Center, where he conducts a lot of research on carotenoids, which is pigment in the back of the eye, and visual performance, and helping to prevent people from getting macular degeneration. So I just want to thank you for joining us. Thank you so much.
Yeah, you bet, Dr. Gelb. My pleasure.
So if you could just give us a little bit the difference between vision and eyesight. What do you got to you? What's the difference?
Well, strictly speaking, vision is, a pretty, well, it's complex, but it's a fairly simple idea where, you're detecting light. And so when you talk to, anybody on the street, they'll say, well, vision is, you measure that with an eye chart. But that's actually going a little too far, probably. Vision is just, strictly speaking, detection of light by some organ. And, in our case, of course, we're talking about the eyes. Visual function, by contrast, is a collection of abilities that we have that range from detection of fine gray levels, contrast, speed of visual processing, visual acuity, the sharpness of your vision, to name a few. And so it gets, the further up, it gets a little more complex, and it's pretty amazing, actually, all of the these abilities that we have, and that you can measure them all. I measure them in my laboratory, and there's a lot of variability among people. And what we're finding is that this variability can be accounted for by largely by lifestyle habits, diet, exercise. These kinds of things actually make a big difference with regard to your vision, your eyesight.
When I see patients, I'm helping one patient at a time. When you do research, you disseminate that research to the doctors, and the doctors could use it on patients. So you're helping millions of patients with your research. Unfortunately, it takes like 17 years before research that the typical PhD does to be translated to physicians. Why do you think that is? And that's kind of a frustrating thing.
Yeah, it is frustrating, Dr. Gelb. I appreciate you, being on the side of research. I mean, a lot of doctors still, they pay attention to the research, but it's hard to break out of, the tried and true, stuff that you learn in medical school or optometry school. Some of these ideas, research by its nature is sort of new. And a lot of the ideas that come out of research are fairly new. Science, of course, you want to replicate findings. You want to trust these findings. And we're at that stage now with regard to visual function and some of the areas that I work in, including nutrition. We're at the stage now where we're really confident that we have a ton of evidence to support all of these findings. And so I think that it takes a long time. It's probably best that it takes a long time. I'm frustrated because I see it in patients that we test, and folks. I've tested athletes. You mentioned those in the Air Force. I've seen it with my own eyes. It works, but it should take some time. And thankfully now we're at the point where it's mature, and so yeah, it's frustrating, but it's probably necessary. We know that it works. We can trust it. It's not something that happened yesterday and somebody's just screaming like a crazy person saying it's going to work.
Well, you were an athlete, and I'm very interested in athletic performance. I still play softball, and 3 days a week. My son I have a 9-year-old who plays baseball, and you've done a lot of research to show that we could actually help athletes through their vision. So maybe we should start from the beginning with carotenoids and build up to how we could actually help athletes.
Oh, this is, yeah, I like that line of reasoning here. Specifically, I mentioned nutrition as a really an aid to vision and the brain as well. And specifically the nutrition that I'm talking about they're nutrients that we get from leafy green vegetables. And so you can imagine that, the average American diet doesn't include a lot of leafy green vegetables. In fact, even on the dozens of studies that I've done, I'll get dietary questionnaire data and ask the participants, and many of them are healthy college-age students. Some of them, are diseased populations. They have glaucoma or maybe macular degeneration. Nevertheless, we get these dietary questionnaires done, and even in those folks that have, uh, you know, 7, 8, 10 servings of fruits and vegetables a day, which is astonishing. That's a lot, right? They don't really eat that much in the way of leafy greens. So, you might be looking at somebody who has a lot of, say apples, pears, tomatoes, something like that. The leafy greens, there are key components in leafy greens. They're carotenoids. And, common carotenoids include like beta carotene. A lot of listeners have probably heard of beta carotene, rich supply in carrots, for instance. But the carotenoids that I'm talking about in leafy greens are lutein and zeaxanthin. They're special nutrients that get deposited in the back of the eye, right in the center of our vision. Right, when you're looking at something, it's passing through these carotenoids, and they're two of the only three, which includes also mesozeaxanthin, two of the three carotenoids that get deposited in the eye, the only ones that do. And they have special functions there. They're antioxidants, so they fight free radicals and oxidative stress, which can damage the retina and it can compromise visual performance. And they're also yellow colored, so they'll shield the eye shield the retina specifically against exposure to short wavelength or blue light, which could potentially damage the retina as well. So they serve a couple of really important functions. There are other functions beyond that, physiological, but just know that they're incredibly important and that we don't usually get enough in our diet. What we found is that people, by measuring the density of these pigments in the back of the eye, those with more have healthier eyes. They are less likely to develop age-related eye disease like macular degeneration. And really, the focus of my work has been visual performance. The higher levels you've got, regardless of age, the faster your visual performance, the better your contrast sensitivity, the better your visual performance in glare. So bright lights, oncoming headlights, those kinds of things. And when you think about it, all of that applies to athletes. When you're talking about baseball, you mentioned your son, an aspiring baseball player. Baseball pushes the limits of visual performance in a big way. Speed of visual processing is particularly important, and that's not a measure that we typically get in the clinic. I can measure it in my lab here at Duke, and let me tell you, it varies a lot. So we'll see people who are in their 60s, in advanced age, with high levels of these carotenoids in their retina, with very fast visual processing, and that feeds into reaction time. It feeds into decision making, prediction of what's going to happen, and that impacts everybody. Driving on the highway or trying to hit a baseball. You contrast that. A couple of weeks ago, I had a Duke student, a male, 21 years old, and he had virtually none of these carotenoids in his eye, no density at all. He was slower than that 65-year-old. And you know what? A lot of his visual performance was quite low. And this is interesting when you consider that, we would characterize this individual as a young, healthy person. But if you really take a close look at the visual system, I couldn't call him healthy. I would say, gosh, you've got some issues. And so, we sent him along the way with some supplements to help boost that level. And we're going to bring him back in a couple of months to see if he's improved. My suspicion is that he will.
So we could use this as a biomarker actually for health of the whole body, because the carotenoids aren't in just the eye. They're in the blood vessels, they're in the brain. If you could expand on that and where else they may be, if it affects the heart, blood pressure.
Yeah, absolutely. It seems that we were designed as human beings to eat more of these leafy green vegetables, get more of these special nutrients. They're incredibly potent. They're great antioxidants. I mentioned that earlier, but they also work on the physiology of the body. And they work in tandem with the body's onboard systems to optimize function. you're right. They get deposited not only in the retina of the eye, in a really special spot there, but they also go to really special areas in the brain, areas that are responsible for memory formation, memory access, auditory hearing function, and also in the visual part of the brain, in the back of the brain. So if you sort of pay attention to Mother Nature and you put two and two together, you can kind of connect the dots. These really beneficial nutrients are going to areas in the body, including cardiovascular tissue as well, like you alluded to, areas that have the potential for really high metabolic oxidative stress. So they're operating at really high levels, kind of like a finely tuned race car. You need to give it just perfect fuel. Everything has to be balanced just perfectly. And to maintain that balance, the body puts these special nutrients in those tissues. And so, we're seeing the carotenoids, they are systemic. They flow throughout the body. So they're in the bloodstream. They fight oxidative stress there. There are trials going on where they may actually be finding that lutein, one of these special carotenoids, helps with arthritis. So any kind of inflammation in the body, by acting as an antioxidant, these nutrients can actually reduce inflammation. That's super important when you're talking about neural tissue like the retina or the brain. And given the fact that, diseases of aging like Alzheimer's disease largely involve an inflammatory component, you think, well, if you've got these anti-inflammatory nutrients in the brain right there fighting that, progression, the cumulative damage caused by oxidative stress and inflammation, that's optimal. The trouble is getting the nutrients into people's bodies. You got to eat these things or supplement the nutrients in order for them to get into the right tissues. The body knows what to do with them once you put them in your body, but you have to put them in there.
It's like one of the songs in our film, Body Knows Best.
Yeah, yeah, indeed.
So can you explain the difference between oxidative stress we're alluding to and inflammation for the people that are listening?
Yeah, absolutely. Typically we see one leading to the other. The primary difference between oxidative stress and inflammation is the involvement of the immune system. So oxidative stress is a process that happens, kind of outside the immune system. It's, brought on by oxygen molecules that become unstable. And unfortunately, there's a paradox here. We need oxygen to survive, obviously. We breathe it in and the body uses oxidative metabolism to run the show. Unfortunately, oxygen is highly unstable. And so when it loses its electron, it becomes unbalanced. It kind of spins out of control. And these are called free radicals in a general sense. They can damage tissue. They cause this cascade of events that leads to more free radicals. What ends up happening is that the body recognizes this process as an assault on the body, which it is, and it will try to sort of ward that area of damage off the oxidative stress has caused. And that is inflammation, an inflammatory process. And that's totally natural. I mean, that's what the body does. The immune system's sort of the top dog in the body. And so with inflammation, just like with a mosquito bite, where you get a swollen welt that's brought on by inflammation, trying to keep that potential, microbes, the bad guys from, flowing throughout your body. The same thing happens with oxidative stress. So inflammation is a good thing, but to a point. When it becomes excessive, that's where you've got problems. The body, then spins off into dysfunction, and it manifests as disease ultimately. So if you get chronic inflammation, that's bad news, and that's what we see in terms of eye disease like macular degeneration, dementia, Alzheimer's in the brain. You get cardiovascular disease as all starting basically with oxidative stress, and then the subsequent inflammation that occurs afterwards.
And what causes inflammation that runs away in our body? What are some of the causes?
Well, I mean, a lot of it is simply the fact that we don't keep things under control. And so the oxidative stress I referred to earlier is, a major culprit in this case. The body is designed to use oxidative stress to a point. It'll use oxidative products and in some cases to kill the bad guys. And so there's a level of it that's necessary. It's when things get out of control that we see problems. And normally the body can keep it under control, assuming you've got a decent diet, includes, fruits and vegetables. You've got onboard antioxidant systems that help as well. When that's all kept in check and in balance, you have the appropriate amount of inflammation. You have it when you need it. It's that excessive inflammation, that cumulative damage over time where you run into problems. And so what we see in patients, even young patients, like I mentioned earlier, in their 20s, supposedly healthy, what we see is the effects of chronic inflammation. It slows things down. It makes the body's physiology slow. It presents as disease. And so really we're looking at a state of deficiency in terms of diet for these good nutrients.
So what are some lifestyle factors that you recommend people do to prevent this from happening?
Well, of course, because a lot of these nutrients are simply diet-based, the body can't make them. Dietary change is a major factor. It's probably the most important thing outside of quitting smoking. If you smoke, the most important thing you can do for your health, overall health, improve your diet. It's easy to say, it's not easy to do. A lot of people get set in their ways, and it can be difficult. But there are options, there are choices. You can opt to, incorporate salads, for instance, in your diet, as opposed to maybe some other side dish. It takes an effort, and you can get enough of these nutrients. For instance, in a cup or two, probably 2 cups of cooked spinach a day. If you can do that, and people used to say, well, if you boil your spinach, all the nutrients go away. They get washed down the drain. It's not true necessarily. Steaming vegetables, cooking them is actually a little better. It kind of warps the plant cell walls, makes the nutrients more available. So if you can do that every day and make that effort, you can make a huge difference in your body. Another thing we're finding in the lab is consistency. So if you can do that consistently 5 to 7 times a week, you're good. I mean, you'll actually notice things like your joints don't ache as much. Vision in bright light is almost within a month or two noticeably better. Things like that. Exercise, of course, we are familiar with studies now where you stress the system a little bit through exercise, even if it's brisk walking for a couple of miles a day. That actually serves to recruit a lot of these healthy nutrients. Some of these nutrients get stored in the fat cells on the body. And so when you exercise, of course, you're causing some metabolism of that fat, and you're at the same time, making available these nutrients to the body. So it's almost like a supplementation from the stores on your body, which is really cool. Lastly, if you really can't or won't, eat vegetables, don't want to exercise or can't for whatever reason, there are supplements available with these special carotenoids that can do a lot of good in the body.
Let's go back to baseball. What does it take from the visual system to hit a baseball?
Wow. Okay. So again, like I mentioned earlier, hitting a baseball, hitting the round ball with the round bat, it's probably the most difficult thing that anyone has to do in any sport. What it takes, the average, sort of hitter, you're facing a pitcher, you don't know exactly what's coming. So there is some prediction based on immediate visual feedback. So there's that prediction, decision making. Speed of visual processing is a big deal. I mentioned more of these nutrients in the eye you've got, the better your chances, the much faster, significantly faster your visual system is. So, for instance, we've looked at baseball players who can sort of see the spin of the ball out of the pitcher's hand. And that's very, very rare. maybe 1 out of 100 hitters can actually, sort of resolve the spin on the ball. But that's information that you can use to tell kind of what kind of pitch is coming. All that aside, you've got, you know, roughly 4/10 of a second from the time the ball leaves the pitcher's hand to when it hits the catcher's mitt. Obviously, that's very fast. You've got estimate between 0.15 and zero point 0.2 seconds to decide whether or not to swing and kind of how to swing. Are you hitting a low pitch or a high pitch or one that's outside or inside? So there's a lot. Other factors include, well, is it a bright sunny day? I mean, that can actually impact how you pick up the ball out of the pitcher's hand. Again, some of my earlier work, in fact, in this area involved the dramatic improvement we see if you've got higher levels of this pigment in the back of your eye and performance in bright light situations, glare, for instance. And so there are a lot of factors involved. All of these factors are, sort of real world factors. They're factors that we don't really test in the clinic. And there are also factors that are helped by these natural substances. This isn't a drug. This isn't some magic bean. These are just leafy greens and other colored fruits and vegetables that, if you get them in your diet in sufficient quantity, you're going to realize these benefits.
So you did studies with baseball players that actually showed that you were able to help them. What was the amount of milligrams and what exactly did you use?
We've done several studies. I've done a few, on athletes, Air Force personnel, other military personnel, so kind of high level visual demands on these folks. And we found that, the levels in terms of supplementation, when you do a study, it's typically not a feeding study where they're eating the actual food, but to, control for, just the actual dose. You give them a pill that contains, levels of these nutrients. And we found that roughly about 20 to 25 milligrams, it's a relatively smallish pill, 20 to 25 milligrams of these nutrients is where you start seeing, the sort of diminishing returns in terms of deposition in the retina. So, and it's equivalent to roughly 2 bowls of uncooked spinach every day. So it's not a crazy amount, really high level. It's reasonable, but that's where you get, kind of the bang for the buck. And after about 3 months, you'll see, you start to see noticeable differences, not only in the level in the eye that we measure, but also improvements in visual performance in a number of different dimensions.
Is it 25 milligrams of lutein, zeaxanthin, and mesozeaxanthin together, or just 25 milligrams of lutein?
Well, it's a combination, and as you might imagine, over roughly the 20 years that I've been doing this, there have been different formulations, different combinations, and what we've arrived at is what it looks like about a 10 lutein, 2 zeaxanthin, and a 10 mesozeaxanthin mix, where you get the strongest response in the retina. You get strong response in the blood when you measure it, how it's going up in the blood, and then the corresponding, if you can make it go up in the eye, typically we know it's going up in the brain, it's going up systemically, and you're going to see these visual performance benefits as well. So the 3 in combination seem to be, where it's at. Again, the 10 lutein, 10 mesozeaxanthin, and 2 zeaxanthin seems to be, after many trials trying different combos, that seems
I know us eye doctors, we like to recommend a brand called Macular Health, and some of us recommend a Zia Vision brand.
Sure.
So they have the 10-10-2 with the Macular Health. The Zia Vision, I think, has 10 and 10 maybe, but no mesozeaxanthin. Do you think it's necessary? I think they're both good products for people that are listening. Do you think it's necessary if you're really intense in baseball to take 2 of those pills a day, double up, or do you think 1 pill is enough?
Well, that's a good point. And yeah, and I should clarify that, I'm an independent researcher. I can't really get into the business end of things, but after testing, many different combinations, we've arrived at this 10-10-2 as being the best. You're not going to hurt yourself by taking, other, mixtures for sure. That I should qualify, everything with that. Doubling up is something that I think, I have my parents, for instance, they're in their early 70s. And, of course, when you age, you worry a little bit about macular degeneration, certainly, among other age-related diseases. And they have extremely high uh, macular pigment. Of course, I'm their son, and they've been doing this for a long time. Um, I've got them taking two of the 10-10-2 formulation. I think maybe for somebody who's younger, I mentioned earlier, working with military personnel, athletes, one, in that 20 to 25 milligram range is probably sufficient. It's not going to hurt you taking two. We've done studies on toxicity. You can't really overdose on these pills. So, I mean, quite literally, don't do this, but quite literally, you could take the whole bottle in one sitting, and your skin might turn orange a little bit because it gets into the skin as well. But you're not going to hurt yourself doing that. So no real worries. But and we've seen that you can go up a little bit faster with more, but again, the diminishing returns as you go higher.
Great, thank you for that. And now, is there any difference with different sports like tennis or golf that you could say any little nuances to help our?
Well, yeah, certainly. I mean, I've worked with a couple. I haven't done any studies on tennis players, but I've worked with a couple of tennis players, and one of them, she was a former professional tennis player, and she would struggle, as tennis, it's hard to appreciate if you watch it on TV. The sun shining down, oftentimes it's in the middle of the day, and if it's not, then they've got stadium lights, and they're obviously bright, illuminating the court. When you look up to hit a serve as a tennis player, you're often looking directly into the light, the stadium lighting, or the sun. And what happens there is that you're temporarily sort of blinded. And then, as your listeners, I'm sure, and you have experienced, these sort of ghostly after images that, you're basically, it's called photo stress. And so, for a while you blink your eyes, and these ghostly images float around for, sometimes even a minute long. She was experiencing this so bad that she'd throw her tennis ball up, hit the ball, and then kind of be blind for the next shot, the return of serve, which, as you might imagine, is not a good thing when you're competing in tennis. And so what she did, she adapted. She said, well, I'm going to keep one eye closed when I serve, and then open that eye when I hit the return of serve, which is better, but it's not ideal. And so I worked with her. She had, become aware of the research in the matter and contacted me. And so we did a supplementation study. Again, not really a study per se, more of a case study in this case, and built up the macular pigment. She was able to tolerate this glare and also recover significantly faster, to where, she, after 3 months, it was pretty fast. She noted, a major improvement. And so she was able to actually withstand the glare in the beginning, the bright light, and then also, recover from that bleaching effect, the after images, and, continue on. Because, as you might imagine, with a single eye, you lose a lot of depth perception, and it can be a little disorienting as well. And both of those things you don't want happening when you're playing tennis.
I don't know if you remember what her macular pigment started. Like a lot of doctors in the field, like myself, we test macular pigment. We have an instrument that does that. What did she start with, and what were you able to raise her where she stopped having those symptoms?
Yeah, it's a great question. I'm glad you asked, because she started at 0.17, which is quite low. We measure on average people around 0.35, and it's a scale that's, I mean, to kind of explain to the audience, the average that we get is 0.35, and that is actually probably really low. We really see benefits at around 0.7 or 0.8 in terms of, prevention of age-related disease, visual performance improvement. And so, 0.17 is dramatically low. I mean, that's approaching zero. And so she started quite low. So no wonder she struggled so much with the bright light. After 3 months, she was up to zero point 0.4, which is a really strong response. A year later, zero point 0.8. And so she was a strong responder, which is an important thing. So she was otherwise, I mean, a former pro athlete, very healthy, but just many athletes in my experience, um, they eat macronutrients, fat, carbs, protein. They're looking to improve musculature and recover from tearing down those muscles and injuries, stuff like that. They pay less attention, although they're getting better now, but they traditionally have paid less attention to micronutrients like these vitamins, special nutrients that we find in leafy greens, for instance, like the macular carotenoids.
I'm happy to say my son is 0.87, and we did
Wow.
each eye separately, and it came out exactly the same. So I know the test was accurate.
That's great. Yeah, that's a great level.
So how about you did a lot of work with night vision? So
Mhm.
sometimes athletes have trouble, the weekend warriors, once it starts getting dusk, even if we put their glasses and correct their myopia perfectly, they're still having trouble at dusk. And I know you work with the military to see how they did it to help their night vision. Can you speak to that?
Yeah, absolutely. It's an interesting point, and a lot of people, as you know, struggle at dawn or dusk. It's that transition period, and also they struggle, when just generally light is very dim. You bump into things when you get up to go to the bathroom at night or whatever. Um, it's very interesting because our early studies showed improvements in bright light, glare, and the like, with higher macular pigment. And what we found when we tested, we did this study, and I think it was published in 2015 with the Air Force, is that visual improvement, or visual performance, I should say, in low light conditions is greatly improved as well with higher macular pigment. So things like the speed of dark adaptation. So if you cut the lights, how quickly you kind of adapt to the dark, you get used to the dark, that's significantly faster. The ability to detect, fine gradations of change in the visual field, like contrast sensitivity, are better with higher macular pigment in low light conditions. It's interesting that these effects run the entire dynamic range of vision from very bright light down to very dim light. And I think what we're finding is that you test these nutrients get deposited preferentially right in the center of your vision, but we're still finding effects that are in the periphery, so outside of where the nutrients are. And that at first that was a little confusing, but I think what we're seeing is that it's just these nutrients, this improved nutrition is impacting the physiology of the entire retina, and indeed probably the entire visual system back into the brain. So we see effects not only centrally when you're looking right at something, but things that are sort of in the periphery, at the side of your eye, so to speak. And so, I think that, you know, generally speaking, we find these nutrients all throughout the body. They're doing good throughout the entire body. And the same can be said for the visual system, the entire visual system, from bright to dark, along all these performance parameters, from the center out to the periphery, they're all improving. And that was, again, like I say, I didn't expect it at all. We tested a lot of healthy volunteers with, primarily Air Force lieutenants, wide range of macular pigment level, and those with high macular pigment just did better, significantly better.
I have patients that come in and they're very sensitive to the light. We call it photophobia. Can we help them with these pigments as well?
Yeah, absolutely. This is it's interesting, the terminology. When you get in the clinic and light is bright and it bothers you a lot, we call that photophobia. That literally translated, it's fear of light. And so you might not be scared of the light, but it hurts. It makes you squint and kind of look away. And but everybody, whether or not you're in the optometry clinic or not, bright light is hard to deal with. Oncoming headlights, bright headlights, a lot of the LED and xenon discharge lamps that they use for newer automobiles now. It's bright. It's bright for anybody. And it's great if you're behind those lights and you're seeing, your car has them, but if they're trained on you, it's difficult. Bright sunlight. We don't typically think of visual discomfort as a visual performance parameter, but it really is. I mean, something that's, if it's bright and you're able to tolerate it, see through it, and still, perform and be able to maintain attention on the target, whatever you're looking at, that's a great benefit over someone who's, you know, basically, disabled and has to look down or look away. And it could be life and death on the highway as well. You get kind of temporarily blinded or you have to look away. So bright light is a major benefit. And that's the one that we probably hear first after starting patients on supplementation is my vision in bright light is noticeably better. If you forget your sunglasses for whatever reason on a bright sunny day, you can still tolerate it and get around just fine. So that's a major benefit.
How can you tell the public how we could help their vision kind of quantify for night driving in your studies? Can you see things doubly as fast? You know,
Yeah, well, speed is one thing for sure. I think that just the ability of the visual system to adapt quickly to different light conditions, and we think about driving at night as, well, that's one condition, that's dark. But the fact is, when you think about the variety of lighting conditions that happen when you're out driving at night, you've got well-lit road signs, you've got patches of where maybe you're driving down a country road and it's kind of dark. You've got oncoming headlights. You've got a diesel that's tailgating you that's, got bright lights on and it's reflecting into your eyes from your rearview mirror. All sorts of different conditions. And the visual system, your eyes and brain have to, kind of rise to meet the bright and then lower back down again to function in the dim light. So up and down fast. The speed of that is crucial. And by having higher levels of the macular pigment, which is of course achieved through nutrition, that I to quantify it in our study, yeah, twice as fast is basically how fast you can go from light to dark, which is huge. When you're talking about the difference between 5 seconds and 2.5 seconds, when you're potentially disabled and you're driving 60 or 70 miles an hour, I mean, that's huge. That's a massive difference.
as people get older, they don't absorb food as well. Do you have any tips to help people absorb the supplements, to absorb the carotenoids a little bit better? Whether it's, if they don't absorb it, whether it's hydrochloric acid supplement or digestive enzymes. What do you think?
Yeah, there are a couple of strategies that help a ton with regard to these carotenoids. They're lipid soluble, and that means that they go into fat. And I know people are thinking, well, I'm not supposed to eat a lot of fat. You don't need to eat a lot of fat, but for instance, on a nice leafy green salad with some other colored fruits and vegetables on there, maybe you've got tomatoes, apple, whatever, you want to use a little bit of fat, maybe oil and vinegar dressing, maybe some kind of fat in there. You don't need to use a stick of butter, but a little bit of fat that will help those carotenoids get absorbed through the intestinal wall. Another great thing, I mean, especially if you're talking about supplements, a little bit of fat. We always say take it with a meal. It's a good idea to get the meal going, so you've got something in your gut. And then the supplement, you want to hold it in that small intestine for as long as you can, because that way it can go across. It can be absorbed and through the wall and then into the bloodstream. So fat is one, a little bit of fat, and then try to don't take it on an empty stomach. That's a mistake where you lose 75% of that supplement that isn't able to hang around to be absorbed as quickly. And then, lastly, like I mentioned earlier, cooking. If you're going to get it from vegetables, cook the spinach, steam your broccoli, break those plant cell walls down a little bit, and that'll make the nutrients more readily available.
When I was a kid, I used to watch Superman, and Superman had X-ray vision. You're like the X-ray vision guy. You could teach us how to make good vision even better. So I appreciate that.
Yeah, yeah, no, it's my pleasure, definitely.
So let's talk about infants. You're an expert on infant vision. Tell
Mhm.
us a little bit about their vision and what's in colostrum, and should we all be taking colostrum? Tell us about that.
Okay. Well, so infants, something that maybe a lot of people don't know. Vision and the brain itself actually develops largely after we're born. There's still, you could argue, at least half of all of the wiring up that has to happen to make vision work that occurs after we're born. In the case of premature infants, it's more, of course, that needs to be taken care of. Uh, Colostrum. Colostrum is the first milk that a baby gets. It's the first milk produced by moms after the baby's born. It's referred to by those in the sort of neonatology, pediatrics, as magic milk, because it's got so many beneficial nutrients in it for the baby. A lot of that is immune function. Other physiological benefits can be realized with the different mixtures of carbohydrates in the colostrum, but it is usually colored a yellow color, and that is driven almost exclusively by lutein, which is one of these magical carotenoids that we've been talking about. So, if mom has had a decent diet throughout her life, but, even just more recently in pregnancy, she's going to have a rich yellow colored colostrum. And this, just listening to Mother Nature, the fact that this colostrum, this important, super important milk, this first feeding basically for an infant, uh, the fact that it's got lots of lutein in it, that should tell you something. That it's important. We know from premature infant studies that if you have babies, these preemies, at a really, really great study, there were a couple hundred of them. The moms couldn't breastfeed for whatever reason. They were assigned different formulas, to one of two formulas, infant formulas. One of them had lutein, the other one didn't. So it was kind of like your perfect little experiment. And a measure of how well the retina is wired up, called an electroretinogram, was done. And the infants that were given, these premature infants that were given the lutein formula, uh, caught up basically to normal term infants within a matter of about 4 months. It's astonishing. The wiring up of the retina, probably one of the most complex processes, that occurs in development, was significantly sped up by lutein. So that's pretty impressive. The question of whether adults should be taking colostrum, and as I understand it, it's popular in some segments, purchasing, colostrum and trying to derive the benefits. A lot of that stuff, I don't think I think that's barking up the wrong tree for adult nutrition. A lot of benefits there, but those benefits are generally specific to the infant, the mother and the infant. So it's kind of the parameters are all balanced for that infant, partly, and also it's an infant, and so we've got a lot of these functions that have been already kind of calibrated. Our immune systems, for instance, are within the first year of life, they're sort of designed, and the balance of all of these, the gut microbiome you hear so much about, the healthy bacteria, all of that balance is sort of set within the first really 1,000 days of life. So to go back and to try to achieve that kind of reset on your system, or improve, any kind of immune function with colostrum, there's no evidence to support that, not for adults anyway.
So let's talk about the pregnant woman who wants to have their baby to be the best that it could be for brain function, eye function. Should they be taking one of these pills a day? Should they be eating the vegetables and take the pill? What do you think? What if your wife was pregnant? What would you recommend?
Yeah, well, I mean, my wife was pregnant. We have three daughters, and doing this research along the way, Yeah, naturally, we had her, taking supplements, also eating in a healthful way. Leafy greens. I'm trying to eat. I mean, with the exception of a little bit of morning sickness in the beginning, it was, she had a pretty darn healthy diet, nice, rich yellow colostrum, all of those things that you can imagine, and and I would say again, with all of the evidence that shows that lutein zeaxanthin getting to the baby through the umbilical cord. I mean, there are data that show that even in utero, inside the mother, lutein is getting to ocular structures, getting to eye structures, uh, presumably doing really good things there. All of that evidence points to, um, definitely including these in your diet. And if you can't uh, eat spinach when you're pregnant for whatever reason, if it turns your stomach, or if it's just you can't stand it or whatever, you can't eat leafy greens, colored fruits and vegetables. Certainly I've recommended this to countless friends. I give talks to pediatrics folks. Take a supplement and get it in your system. It's consistent with good nutrition generally, and the more science we learn about, the better we understand the importance of you know these nutrients in wiring up the retina, the brain. You're going to do your baby a lot of good by doing that, I think.
How about omega 3s?
Hmm.
What's your
Omega
recommendation?
3s, I mean, there's this sort of trinity of nutrients in the brain, in the eye. It's lutein, DHA, it's an omega-3 fatty acid, and vitamin E. Those three kind of work together. So I always try to qualify when I'm talking to people about this that lutein, zeaxanthin, and mesozeaxanthin, they aren't really magic bullets, but they work with other things. And one of the most notable nutrients they work with is DHA, which we get primarily from fatty fish. There's a lot of DHA. A lot of listeners will know that it's related to improved cardiovascular health. We're learning about how important it is in the brain. Your brain is bathing in DHA. Incredibly important. It allows the brain to function at high speeds, allows for the rapid exchange of these special ions. The trick is if you've got a lot of DHA in an area that is operating in a fast manner, like the brain or the retina, you run the risk for oxidative stress. So scientists like me now are of the mind that, well, if you've got a lot of DHA, but lower levels relatively of, say, lutein, lower levels of vitamin E in those structures, you run the risk of damage, especially cumulative damage over decades of life. And that damage can manifest as, Alzheimer's disease potentially, Parkinson's. We know, certain cancers at the base of cancers is oxidative stress. And so if you put those nutrients in, you allow the brain and the eye to work fast, but to also, quench any damage along the way. And so you're promoting optimal function. And I think that's the basis for a lot of these effects that we see in the lab. The brain can just go nuts. It can run super fast. The eyes can run super fast as long as there's that protection in place. And you're, quenching free radicals. You're reducing oxidative stress and inflammation. And so I think it's a, sort of that magic, sort of feedback. The body's expecting, a certain template to be in place. And if there's some weak link, it's not going to work very well. Certainly one of those weak links is, the lack of these carotenoids.
How about vitamin D3 and a B complex?
Well, I mean, these nutrients, D3, super important, and it's in the public eye. We're getting less and less exposure to sunlight. Uh, Exposure to sunlight is incredibly important in good measure. Certainly it gets a bad rap. Obviously skin cancer, these kinds of things. But our lifestyle is such that we're spending more time indoors on screens. Phone, tablet, computer. And so we're not getting a lot of that ultraviolet radiation. It's important for a lot of reasons. Obviously, I think, again, listening to Mother Nature, we, understand that the body makes vitamin D from sunlight. It actually uses cholesterol in the body in combination with this exposure to UV light from the sun to make vitamin D. And that's really important in terms of calcium absorption in the body. And so you see those with, lower sunlight exposure at higher risk for osteoporosis, for instance. So, just walking around outside for 15 or 20 minutes a day, you get plenty. There are also connections to, uh, you know, age-related cognitive decline and a reduced amount of vitamin D. So that's important to consider as well. And so the picture I like to paint involves, urgent matters like, leafy greens, lutein, zeaxanthin, and mesozeaxanthin. Get these things in your body. They help the eye, they help the brain, heart. That's immediate. Still urgent, but maybe not quite as urgent, vitamin D, vitamin B, these B complex vitamins that, the foods that people eat, it's not as big a variety on average than it used to be. Certainly in the sort of going way back in the ancestral environment, we kind of were forced to eat a lot of, leaves. These were what are called fallback foods. You need to eat leaves, grasses, nuts, berries. You got to eat those to survive. And then occasionally maybe you get some meat, you hunt an animal. And it's kind of reversed now. We're eating a lot of starches and meats, and on average, not everybody, but certainly on average, and fewer of the leafy greens, nuts and seeds and fruits and things like that. So the variety and the profile is kind of flipped. And so those things, the body can only do so much to kind of keep up with the potential damage there. And so most of these negative outcomes are seen kind of at the end of life. And as I'm sure you've seen in the clinic, we'll see 85-year-olds that come in here and they are incredible. I mean, they look like, their eyes look like, the eyes of a 30-year-old. You look at the retina, you see that, the health, they're sharp as a tack. 10 out of 10 times you ask them, are you a smoker? No. Okay, that's one thing for sure. Tell me about your diet. Well, they've had a consistently good diet for the majority of their life. Are you physically active? Yeah, they've exercised, maybe not crazy marathoning their entire life, but, they've had physical activity, whether it be through work or, just being active physically, going to the gym a half an hour a day. These kinds of things add up over time. And it's just that little 0.5% every day, where you go downhill, it's hardly noticeable, but then you get, to the point where it's a disease. And then you say, oh man, here we are. So, but what I'm saying is you can take steps to completely, well, if not eliminate, reduce your risk of going down that road.
Vitamin A, eye doctors almost have forgot about vitamin A. Talk about the importance of vitamin A. Is it still important?
Well, it is. I mean, vitamin A is fundamental. I mean, as you know, as an eye doctor, we need vitamin A to synthesize what's called the photopigment, and these are pigment molecules in the back of the eye that catch light. And without light, I mentioned earlier that vision is just simply the detection of light by an organ, and without the ability to catch light, you don't see. And in malnourished populations, I know there is one in Tanzania in Africa that was recently characterized. They have a vitamin A deficiency, and that will manifest as in bright light. They can still see okay, although it's not particularly good. But boy, once the sun goes down, they're virtually blind. And it's just completely based on the fact that they don't have enough vitamin A in their diet. Here in the United States, typically we don't have to worry too much about vitamin A. We've got fortification in milk, breakfast cereals. We get a lot of vitamin A from the diet typically. However, if there is an issue, some folks with extremely rigid diets or extremely picky eaters, they can manifest with a night blindness. I don't know if you've ever seen it in your clinic. I haven't personally seen it, but it exists. So it is fundamental. I don't want to say it's nothing we, have to worry about. Certainly you want to be concerned about that situation, but typically in America, we get enough of vitamin A in the foods that we eat.
Tell me about blue light. You know, there's some controversy. Is light really dangerous to the eye? And, you know, coming off these screens, 455, you know, looking at this blue light all the time, somebody that has macular degeneration, uh, should they be wearing filter glasses that are filtering the blue light? And is it really, there is some studies that show it does kill some of the retinal cells and that it can kill retinal cells. Talk to me about that.
So, blue light, why is blue light a concern? It's, you think about blue versus, orange, red, yellow, and say green. The shorter the wavelength, the bluer something gets, into violet, the higher the energy that light has. And so, as you might imagine, you put highly energetic light onto a tissue like the retina, which is pretty vulnerable to high energy damage. It's more potentially damaging. And so from a screen, if you're looking at a computer screen, I tell people, don't panic. I mean, gosh, you're not going to acutely damage anything in the retina with the blue light that's coming off of the screen. Now, that said, I've talked about cumulative damage over time, and they've run, models, and they're animal models, but you sort of mimic what a human being would do with sort of an 8-hour job looking at a computer screen every day for 10 years. And indeed, like you mentioned, they show that there is some damage. There are cells that potentially, atrophy and die, and that's a concern because the neurons in the retina that give rise to vision, they don't regenerate. So some cells do in the body. Largely neurons like those that are in the eye and the brain don't. So we want to hang on to as many as we can. So based on those models, yeah, if you're highly active, like a lot of us are, on a computer screen, on your phone, tablet, what have you, there's enough blue light coming off cumulatively to do damage to the retina. I don't think this is a huge concern for most people, and the reason I say that is because the sun kicks off a lot of blue light. We see the sun as just sort of white light or yellowish, but there's a lot of short wavelength light or blue light coming off of the sun. And just to put it in perspective, the total amount of blue light that you get from a computer screen in an 8-hour day. So you're looking at the computer screen for, say, 6.5 hours, which is kind of an average amount for the American. In about 15 minutes outside, you get that much exposure. And so the eye is adapted to handle this. It's supposed to be anyway. I mean, we have a little bit of protection from the macular pigment, quite a bit actually, if you've got enough in the back of the eye. And of course, that's predicated largely on diet. You also have the lens in the front of the eye, right behind the clear part of your eye, that will actually absorb quite a bit of this high energy light. So the eye is pretty adapted. The problem that you see with computer vision syndrome, as they've termed it, is people getting headaches, neck strain, eye strain, eye fatigue, and that can be brought on by blue light. So even if you see the screen, the computer screen, as a nice vivid white color, how that white is made for a computer screen, for instance, is by mixing a blue with a yellow. And so, your listeners will say, wait a minute, blue and yellow make green. And that's true of paint. But for light, if you mix a blue and a yellow, you get a nice rich white, especially if that blue is a little bit stronger than the yellow. So you might see white, there's a lot of blue in there. So there's a lot of energy. What we found in studies is that when the eye is exposed to blue light, there's more squinting involved. So you kind of squint your eyes up a little bit more. You might not even realize you're doing it. And over time, that squinting can lead to tension headaches. And so we've actually done a supplementation study on college students who use computers like crazy. I mean, they're on social media and taking notes in class on computers nowadays. And so, some of them are reporting 12, 15 hours a day in front of screens, which is alarming in its own right. But anyway, it's a perfect population to study. We supplemented them with the 3 macular carotenoids, lutein, zeaxanthin, and mesozeaxanthin. and found that after 6 months of supplementing, it was a placebo-controlled trial. So, some of them got basically an inert pill, the other got the carotenoids. We found a reduction in headache frequency. 1 per week, it went down. Eye strain, eye fatigue, along with other visual performance improvements. But that was pretty exciting. And in just 6 months, able to build up relatively low macular pigment. You build that up, reduce squinting is most likely the cause. And you see these benefits.
Fantastic. I mean, I've read some studies and some things that the blue light, even outside in the sun, even though it has more energy, it's balanced by infrared and UV, and the infrared is almost like a protection. And so it's different than the blue light coming off the screen because it's not balanced with infrared, which is the good guy, bad guy kind of scenario.
Yeah, well, I mean, I'm not sure that I would go with the infrared explanation, but what I will say is that the sun is a heck of a lot brighter than your average computer screen. And so we know that when you throw bright light onto the eye, the pupil constricts, and that will limit the amount of light getting to the retina. That makes your eye a little more vulnerable when you're in a situation indoors looking at a computer screen and your pupil is relatively large, perhaps 5 or 6 millimeters even, and that lets in quite a bit more of that blue light. So that could be a concern for sure.
Well, thank you for that. I want to thank Dr. Jim Stringham, PhD, who is at Brown University Eye Clinic, for being with us today. And he's given us fantastic information. But if somebody wants to get in contact with you or learn more about the research that you're doing, how can they do that, Jim?
Yeah, no, I'd be happy to field any questions. You can, and actually, I'm at Duke, actually, not Brown, but
Oh, I'm sorry.
it's okay, close enough. Anyway, but you can get me at james.stringham, that's a Stringham, at duke.edu. Feel free to email me, and I'll, and if you don't have the email in front of you or if it's not made available, you can look me up, but james.stringham at duke.edu, and I'd be happy to answer any questions.
Thank you so much. I really appreciate it.
You bet, Dr.
Really, really kind of you.
No problem.